All right, good morning. Good to see you on this Friday, and we usually call it Entertainment Friday. But first, we want to begin with a conversation that is, quite serious and touches every single aspect of our lives and adolescence as well, to be specific. And this is as far as sexual health is concerned, because yesterday, that is the 4th of September, the world marked World Sexual Health Day. But we want to continue with the conversation so that it just doesn't end on the very day. We still want to continue with the conversation this morning, but we have a special focus, and that is providing support to pregnant and parenting adolescents right here in the country. And of course, there was a research that was done, and this is by the center that is African Population and Health Research Center, APRC. HRC, there's a H somewhere. Yeah, there's something was missing. I was like, what exactly is missing here? That was that, and we also wanted to focus a little bit on the research and what they found out and why it's important to have the conversation. Okay, so it's going to be an amazing 1 hour of the first part of the show right here on Your World. My name is Winnie Lubembe. Really, really good to see you this morning. And my guests are already here. And on my immediate left, as per usual, this is the tradition that we always start with. Okay, on my immediate left, we have Jane Mangwana, who is a Policy and Advocacy Manager from the African Population and Health Research Center. Good to see you. Good to have you. First time on Your World.
Yes.
How are you doing? How are you feeling?
I'm doing great.
Yeah.
I'm so relaxed. Thank you for making me feel that way.
You're most welcome, and thank you for making the time really to come and join us on this important conversation. And we also have Dr. Anthony Ajayi, who is a research scientist from the African Population and Health Research Center, joining us again. The last time you were here is like a few years back. Yes. You were saying 2022.
2022.
Ha! Welcome back.
Thank you.
How are you feeling? How are you doing?
I'm feeling great as well.
And thank you so much for making the time, really, both of you, to come and have this very important conversation. Before we talk a little bit about the research that you guys have done, can we just talk about the importance of the day, and that is World Sexual Health Day? Yes, I know it was yesterday, but we'll still continue with the conversations today. Can we just understand the importance of the day and from your perspective? Yeah. Jane, you want to go first?
Sure. So the World Sexual Health Day is very important, particularly to commemorate the work around reproductive health and rights. And we are looking at the beneficiaries, the women of reproductive age, and including the boys as well. More often than not, people think that reproductive health is only focused on women and girls alone, but in this context, we also have in mind that we have the boys that are in the picture. But beyond that, celebrating the champions within the community that are very important to ensure that the conversations really speak to each other, and we are able to really resolve some of these issues that relate to reproductive health.
Okay.
Thank you.
And then from APHRC's perspective, and Dr. Jai, I want to bring you in, on this and just understanding the day, and not just really marking the day in itself, but also the work that you guys are doing. Can we just understand how this is important to you, and also tell people a little bit about you guys?
Yeah, let me begin with the later part. The African Population and Health Research Center is a premier research institution that is African-owned and African-led. We work across Africa country, but currently we serve about 35 African countries. Okay. And we have, up to around 50 projects in some of these 35 countries currently. Okay. We not only conduct policy-relevant research or actionable research, we also, try to strengthen the research ecosystem by providing capacity strengthening for people to do research. As of now, Africa contributes just about 2% of world research outputs, yet we are more than 10% of the world's population. So our share of the global research output in the world is really low. So part of our goal, our mission is also to see how do we contribute to the next generation of researchers who will be able to bridge that gap in terms of productivity. But in terms of World Sexual Health Day, one of the key areas we conduct research is in sexual and reproductive health. So it's really an important day for us. As Jane said, it celebrates the work we do. But at the center of the work we do are the beneficiaries as well in the community. So we want them to enjoy their sexual health, free of diseases, fear, you know, cultural taboos, and all these other things that might hinder the realization of the rights. So for us at the African Population Rights Association, we are proud of our contribution to the research in sexual and reproductive health, and also to some of the interventions that are helping people to realize their rights.
And I like the fact that you said it's African-led, you know, meaning, because again, in as much as the challenges are there, but there are also challenges that are unique to our continent and unique, say, to our different countries. So having the different, you know, countries represented, and it's easier then to address the challenges that are faced in, you know, our continent, and not just to say we only focus on the African continent alone, right? But even talking about sexual health, we have a question for you this morning, and the question is very simple. The question goes: say one thing you would tell your younger self about sex and relationships. What is that one thing that you will tell your younger self about sex and relationships? That is the question that we're asking you this morning, right here on Your World. And you know the drill by now. At NTV Kenya, across all borders, how you can reach us. Feel free to use our WhatsApp number, 0112-500-400, or better yet, give us a call and tell us what is that one thing you will tell your younger self about sex and relationships. And Jane, just coming back to you, in terms of advocacy, which we've talked about, what role then would you say, you know, advocacy plays in shifting, you know, all those things we talked about, the myths, the misconceptions, the misinformations that are there? So how important is advocacy in this case?
That's a very good question. First of all, we know there's a lot of stigma around adolescent mothers or pregnant and parenting adolescents. And this stigma emanates within the community and even the school themselves. You find that pregnant and parenting adolescents, when they're in the school, more often than not, they are not expelled. They're actually expelled from schools by the head teachers. So that is the first stigma. And then the second thing is that the stigma around even the students, the pupils in school, they do not want to associate with these pregnant adolescents. And then there's also stigma within the community, in the sense that you find that a household will even tell their daughters that do not hang around the specific girl because she's pregnant. And so you see that these adolescent mothers really face a lot of stigma. And to address that, we need to really use the structures within the community, meaning that we have to have community dialogues, engage with the community members, so that we are able to frame the conversation in a way that the community is able to come in and support these adolescent mothers. The other way that advocacy is very important is that using evidence, stories of change, success stories that have worked. We normally have adolescent mothers that have made it in life. And so really talking to those women or girls so that they are able to share their experiences, talk about how they got out of that whole situation, how they were supported. So that's one form of advocacy. And then finally, advocacy around working closely with the media so that the media can go out there. People like you, they are able to share the success stories of adolescent mothers who've been able to go back to school, pick up the pieces, and then reintegrate into the community. Thank you.
And just speaking of that, I think the biggest question is then the how, because some time back here on the show we had a conversation with adolescent mothers like 18, 17, 16, and those two parts to it. There was a part where they said, listen, the fact that I got a baby when I was still a baby, it doesn't mean that that is the story of my life. It doesn't mean that my life ends there. But then again, there's also this other part where people were like, yeah, so talking about it, it's like you're advocating for teenage, you know, pregnancies, and you're telling the young girls, it is okay, you go do what you have to do, you know. So sometimes it's like a catch-22
Absolutely.
situation.
Absolutely. But you see, the thing is that the adolescent mothers really need to be supported, so that they can also feel confident to go back, to be reintegrated back into schools. And so we, of course, will talk about policies later, because we have guidelines that really speak to that. But the thing is that we also want to support them so that they feel that there's the aspect of inclusivity for the adolescent mothers.
And safety to just come out and share their stories as well.
If I may add a bit to that, you see, over the years, much of the work on adolescents is about preventing teenage pregnancy, preventing HIV, and to a great success. You know, there's been a lot of success in terms of preventing HIV, preventing pregnancy, maybe, significant success if you compare to, say, year 2000 or 1990. But the reality is that so many young girls are still getting pregnant, despite all the work to prevent pregnancy. In fact, if you look at funding or, you know, the sheer amount of resources spent on adolescent sexual and reproductive health, maybe 90% is, or even 95% is focused on preventing pregnancy. So it means that there are certain things we are still getting wrong if many young people, you know, continue to get pregnant. So the work around supporting adolescent mothers or pregnant adolescents is not to encourage young people to get pregnant. Even as I said, most of the resources is still directed at preventing these pregnancies. But we can do both. Because it's our collective failure if young people are still getting pregnant. And it might be easy to put all the blames on the young girls and say, you didn't listen.
You're this,
you're promiscuous, you know, you can say all of that. But the reality is, if you do not support them, then you are just sort of contributing to poverty, because it creates a cycle of poverty in the community. You know, I often say that supporting adolescent mother in itself is not a cost, or it's not a charity. Because what you are basically doing in that sense is that you are investing in the future of the country, in the economy of the country. Young people are the leaders of tomorrow, so they say. So pregnancy, it seems like a crisis that happened at some point, and it shouldn't be the reason why we do not realize the potential of our families, of our communities, of our society, of our country, because abandoning them means that we don't want to realize the potential we want. So we can do both, and doing the work around supporting young girls is not encouraging young people to get pregnant, and we can continue to advocate for preventing these pregnancies as well.
Work on both, prevention and also the support.
Okay.
And just recently there was a research done, you know, in the informal, you know, settlements, and especially here in Nairobi. Do you want to tell us a little bit about that and the findings?
Yes. So at the African Population and Health Research Center, I mean, truly since year 2020, we've been trying to understand the lived experiences of pregnant and parenting adolescents. The work on lived experiences is really important because it helps us to understand from the perspective of people that, you know, had these experiences of getting pregnant at such a young age, to understand their plight, you know, what happened prior to getting pregnant, what are some of these factors that contributed to that, and when they got pregnant, to just sort of understand how they navigate the pregnancy and post-pregnancy, so what happened. And what we found really is that almost 8 out of 10 of them reported their pregnancies to be unintended. So it's not like they go out to say, I want to get pregnant. You know, majority of them are not married, so you know, the pregnancy could be described as accidents. It's an accident that happened as a result of many reasons. Some as a result of sexual violations, they were raped or experienced sexual coercion, and that's a substantial number of them that reported that. But some also got pregnant because they were dating guys, and in the hope that the guys will support them financially. As a result of some of the vulnerability they experience at home, not having enough food to eat, not having resources to buy self-care products and things like that, or even menstrual pads. And then, of course, some also got pregnant. If you begin to look at their family environment, you know, some live in homes where the parents are not available to parent them appropriately because probably they're also trying to fend for the family, and they were away. So a bit of supervision issue, not adequately supervised. But all in all, I think all of those things are, you know, what we call distal factors. The proximate factor is they engage in sex and they didn't use protection. That's the reason they got pregnant, really. And then you begin to try to ask them, why didn't you use protection? And then they say, no, we felt those things are for adults. Contraceptives are for adults. They are not meant to be used by young people. You know, or some said, I didn't have much knowledge about it. It's only when I got pregnant that I begin to learn about how to do prevention, so it was already too late. So again, lack of knowledge around how to prevent pregnancy is also another major challenge that we found.
Yeah.
And again, if you're thinking about why is it that young people didn't know how to prevent pregnancy, it's a failure of the society, I would say, because if people know about how to prevent pregnancy, maybe they will probably not be pregnant.
Yeah.
Let me also, give one important statistics. Pregnancy, getting pregnant is one of the reasons why, main reasons why young people are dropping out of school.
Okay.
It's among the, in fact, for the study we did, more than half of them were still in school when they got pregnant.
Okay.
So again, pregnancy is now becoming a stumbling block to realizing education rights.
Yes.
Because in the Constitution or even global instruments admit it clear that education is a right. Yes. Basic education is a right for all young people. So pregnancy now is becoming a stumbling block for them to realize that right.
Yeah.
Now, we also try to understand how they navigated the process. When they got pregnant, you see, it creates an environment of fear of the unknown. What will happen? How do I even tell my parents about it? So you see a lot of them ran away from home because they were too scared.
Yeah.
And then for those that remained at home, they were also being abused at home verbally. Some said, my father did not talk to me throughout the pregnancy. We're just in the same house and we're like strangers. He didn't want to have anything to do with me or the pregnancy. Some were actually chased away from home by the parents because now you brought shame to the family, and embarrassment. So, but also in clinics, they also experience some stigma, verbal abuse. And a lot of them didn't want to go to clinic in the first place. So after maybe 6-7 months of pregnancy, they managed to persuade them to go, and then they still experience stigma in clinic. 91% of them are out of school, which is a shocking statistics. Despite the policies on re-entry, majority are out of school.
Yeah, I mean, we're due for a break, but then when we come back, clearly there's a very big gap, and this is from, say, the community, families, but would also on a larger scale want to understand from a policy level, what are some of these gaps that, exist, and then how do we close it? Because like you said, yes, then the number of teenage pregnancies, yes, has reduced over time, but still, young girls are getting pregnant. So then how do we strengthen when it comes to policies, when it comes to dialogues and conversations to prevent, but also to support, the adolescent mothers. So there's so much to come from the other side of the break. To stay with us, the show is your world. But also remember the question that we're asking you this morning, and it's very simple. Say one thing that you would tell your younger self as far as health and relationships are concerned. What is that one thing you'd tell your younger self about sex and relationships? We'll come back and also look at your feedback across our social media platforms. That is NTV Kenya across all board, and as well as on our WhatsApp number 0112 500 400. So see you after the short break. Welcome back. Welcome back to the show. The show is Your World, and on this Friday morning, on the first part of the show, that is, we're having a very important conversation that really touches on each and every person, who's watching us, and every single aspect of our lives, because we have sisters at home, we have cousins, we have friends amongst us, and some of them got pregnant when they are teenagers. So even as the world celebrated World Sexual Health yesterday, we want to really put more emphasis on providing support to pregnant and parenting adolescents right here in the country. And we have, Jane here with us, Jane Mangwana, together with Dr. Anthony Ajayi, all from APHRC. I don't know why the H is like difficult to come up about this morning, but we also have a question for you, and the question is, say one thing you tell your younger self about sex and relationships. What is that one thing that you would tell yourself, your younger self rather, about sex and relationships? I'll be going through your feedback in just a second, but yes, before we went to the break, so we really got to understand the findings from the study which happened in Korogosho, right, here in Nairobi. But at the same time, can we just look at then the policy level? What are some of these gaps that are existing? How detrimental they are if we don't close it as soon as possible? And what will be some of the recommendations from you guys?
Yeah, that's a good question. First of all, we need to appreciate and recognize the government efforts in ensuring that there are policies and guidelines to support pregnant and parenting adolescents to go back to school. And that being said, yes, we have the guidelines and policy in paper. And one of the challenges is the enforcement, or some people like to say the implementation and evenness. We have the 2020 school re-entry guidelines. And that whole process was led by the Ministry of Education. And it mandates that adolescent mothers be allowed to go back to school so that they continue with their education. We also have the Children's Act 2012, and it states that any person under the years of 18 should be supported or have a right to education. And so you see, we already have the policies. The only issue is that the implementation bit of it. And so one of the challenges or the gaps is that these policies are implemented in some schools, and in other schools they are not implemented. And then there's also the other challenge of people are not aware of these existing guidelines. People in the sense that the principals in school and even the adolescent mothers themselves. Because I have a right, if I'm aware of the existence of that policy, the re-entry guidelines, then I should be able to speak for myself and be allowed to go back to school and complete my education. The other challenge really is around the monitoring, the monitoring and the accountability of the guidelines to ensure that the framework in place is working. And so if we don't have people to be held accountable and for an assessment, an analysis to be made, to be done, to ensure that indeed these guidelines are working, then that's a challenge in itself. And so really the bigger part of it is that we have the frameworks, the policies on paper, but the problem is the implementation bit of it
is where there's
full,
a big problem.
to a full extent.
Yes. All right.
Yes.
And then, so then what strategies, Dr. Jai, would you say would work? Because for a very long time, I'm pretty sure you had the conversation about abstinence, and young people right now clearly that it is not working. You know, there was a study done and they said adolescents, especially between ages 15 to 24, they're having more sex than married, you know, couples. So then what strategies should we employ to ensure, especially when we talk about prevention, and then also for support? You know, would you recommend that would work?
We have a lot of experience when HIV was a thing, right?
Yes.
Maybe not as much now. And then you see messaging like abstinence, but they don't say only abstinence. They always say condomize.
Yes.
They said abstinence, condomize, and be faithful to your partner.
ABC,
you know, ABC. You know, so all those. So we know that it's probably not only abstinence that will be the solution. We already know that's true through the work we did around the HIV. So. Yeah, I know I don't know why it's still a controversy to say we use all the tools in our toolbox or toolkits to prevent pregnancy among young people. I know there are people that believe so much that abstinence should be the only message to young people. And I believe the church is already doing a good job of preaching that. But should we use more toolbox other than abstinence? Maybe the answer is absolutely yes, we should do more. Young people these days also have some information. Some have information. It's not all young people that engage in sex that get pregnant. In fact, there was a study I did earlier where we analyzed about 1,800 young people. Some are using abstinence, and some are, you know, practicing protection. And the ones that are not protecting themselves got pregnant. So that's how you can group young people. Some using abstinence, some protecting themselves, and some not protecting themselves. The ones not protecting themselves are the ones getting pregnant. So the question then is, how do we reach out to this last group that engage in sex but are not using protection? What would be the best solution to them? Telling them to stop engaging in sex might not be the most effective solution. So we need to do more in terms of educating young people on how to prevent pregnancy, but not only pregnancy, how to prevent HIV, you know, all these sexually transmitted diseases. I think it's their right to be. If a right to information on sexual and reproductive rights, it's actually a right, and we shouldn't be denying young people that right. So and people having knowledge on how to prevent diseases, pregnancy, will not necessarily make them engage in sex. Because that's also another contradiction that people say, No, if now they know how to prevent HIV, they will now go and engage in sex. So
Yes.
that's actually not the case.
Yeah.
Yeah, because I know that if I engage in sex, I might get HIV, I might get pregnant.
Yes.
Okay, maybe I stay away from sex. But the ones that do not stay away, you know, having that tool to be able to prevent and protect themselves is really important.
Yeah. Is it also like more of like the communication aspect of it, like how we're communicating these things? Because you speak to young people and they're telling you, don't tell us not to, tell us why not to. Because for us, when we were growing up, you're told no, and you stick with no. You don't ask questions. But now they're telling you, no, tell me don't do this, but also tell me why I shouldn't do it. So I don't know whether it's like a communication issue.
Absolutely.
Yeah.
I mean, the why bit of it is very important because we tell them don't do it.
Yeah.
Why is because of the consequences that really come with you having unprotected sex. Definitely you'll get pregnant, you'll get diseases, and there's a lot of negative things that come with it.
Yeah.
And so the why bit of it is very important, but also again going back to the point of using champions and people that demonstrate the why bit of it as to why then we are encouraging young adolescents to really prevent pregnancy by taking the right measures, condomizing, and really abstaining from sex.
Yeah. And what role then would you say CSOs and, you know, other, say, either CBOs, you know, community organizations can play? Because people would say, yes, but we have them, but are they empowered enough? Are they, like, how then do we really leverage, you know, on their existence to help as many young people out there, either, yes, prevent pregnancies, but there's also so many other, you know, things that might come with the fact that they are actively engaging in sex.
Yeah, the civil society plays a critical role in advocating for adolescent mothers. One of the ways they do that, of course, is to get the stories within the community and make sure that those stories are told to the right people, including policymakers and even the media. And so that's the role and where the CSOs come in. Also linking that information to policymakers. And we call that part of evidence. So that the decision makers can use that evidence to inform policies that will be beneficial to the adolescent mothers. And so the CSOs are very important in terms of really picking that information or the evidence and sharing that with the decision makers, the media, but also most importantly, even creating awareness among the community, because what we want is that the community is able to support the adolescent mothers. Then the other important role of the civil society organization is speaking to these adolescent mothers. Because we know within the community, the civil society organization has to work with the grassroots organizations who identify these adolescent mothers, and then they're even able to give them support mentally and work with them the journey and link them to programs that will be beneficial to the adolescent mothers. So they are very critical in terms of linking the conversations within the community and the decision makers.
Yes. Because like we said when we started the show, it's not just the getting pregnant part of it. There's the dropping out of school, there's the shame, there's the stigma, there's being cast out of families and churches and, you know, even schools, you know, for some matter. So, yeah, I see that. But so we understood the gaps that are there when it comes to our policies and the policy framework. But really from a research perspective, what are some of these gaps that you have noticed, and then especially when it comes to either parenting or adolescents, you know, who are actively engaging in sex, and how important is research in closing those gaps?
We've done a lot of research. I think we know quite a lot in terms of the gaps. I think the main ones, or the ones that gain a lot of attention, is the issue of re-entry into school. And that's as a result of some countries banning young girls from school because of pregnancy. In 2020, Sierra Leone reversed their ban. Tanzania also did. They reversed the ban on return to school because education is a right. You can't take it away from them because they got pregnant. However, there are a lot of other gaps that are not being, that are probably not gaining as much attention. For example, issues of mistreatment in clinic and abuse of adolescents is one of the main issues. I don't think it's received sufficient
Yeah.
focus.
Okay. All right. Let's fix your mics a little bit, and then we'll come back and address, so, because we want to hear that, you know, in terms of how research, you know, is important. But at the same time, you know, when you're thinking about even family members, for example, or places of worship, how then do we change the narratives in terms of our approach to, like we said, the communication and the information that is out there as far as teenage pregnancies, adolescents, you know, mothers and those ones who are parenting? How do we really shift that narrative and involve all those people into the conversations?
And I like what you've said about involving all those people. Indeed, it's a matter of having dialogues with the different stakeholders that are very crucial in supporting the adolescent mothers to really go back to school. And so one of the ways is just being intentional and deliberate and having conversations with the people that are very important and people that need to hear this about these stories.
Okay.
Religious leaders are very important because even some of the religious leaders, I'm sure they have experienced daughters who are pregnant. And perhaps what they would want to do is hide the daughters. And so we know the stakeholders. We need to have dialogues with the principal heads in schools. We need to have dialogues with the religious leaders and the health providers that even provide health care to the adolescent mothers.
Okay.
So the word is really involving them into this conversation. Each stakeholder has got an important role to play to make sure that the adolescent mothers are supported. So intentionality in terms of going out, reaching out to them and having conversations to see how they can support the adolescent mothers, but more importantly, using evidence to engage with them. And we can also share success stories of countries. Countries like Zambia have done it very well in terms of, they even provide, they have a policy on re-entry to school for adolescent mothers, and they provide maternity leave for these adolescent mothers. So it's a matter of just having conversations with the stakeholders within the community so that they are able to walk the journey, support the adolescent mothers, and consistently, you know, engaging them into these spaces.
Yes. Yeah. And even on a policy level, I'm pretty sure you've had this conversation from the young people who are saying, do not make you know, policies and laws and you know, all these things about us without us on the table. Involve us, and if you don't, we'll bring our own table and we'll sit there and we'll come up with these policies. So very quickly, then, what are some of these changes and reforms that need to be you know, in place, and how do we involve the policymakers in these reforms and in these changes as well?
Yeah, so one of the things, of course, we have the legal frameworks and the policies, the guidelines, re-entry to school. So one of the things is having the bit of, because we know that even the adolescent mothers, they come from poor social economic background. And so combining the policy and having aspects, economic aspects that ensure that there's social protection that encompasses the adolescent mothers so that they are supported. If they don't want to go back to school, there is also an alternative for them to go to vocational training centers where they can acquire skills and then they're able to build themselves economically. But also the other aspect is having the child care component, because remember, these adolescent mothers, they have children and they need someone, as they go back to school, they need someone to take care of the child. So combining the elements of really allowing them to go back to school, you have the child care support for them, but also ensuring that they are empowered economically through the social protection programs, allocating some funds for them to be able to really build, develop themselves and use those skills to even start a small business and they are supported. But in addition to that also, having a component that addresses the mental health aspect, because we know that that is something that is coming out even through the research, that adolescent mothers need to be supported in terms of their mental health.
Absolutely. Again, not just the linear, that's the pregnancy, but you know, all these other areas, like we said, and mental health. Really, really happy that you pointed that out. And Dr. Ajay, so we're talking about, yes, the gaps that are there as far as research, but also the areas where research is very critical, so that we do not leave any adolescent or any parenting adolescent, you know, behind it, especially when it comes to our own development agenda right here in the country.
Yes, absolutely. In terms of research, we also need to be able to generate evidence on what works to address the issue.
Okay.
At APHRC, we are testing intervention. In fact, currently our people on the field are recruiting young mothers into this study. We want to test 3 interventions. There's a bundle of intervention together where we provide conditional cash transfer, conditional return to school, or optical vocational training. So we provide cash transfer to young girls that decided to return to school. We also provide some education support as well, in addition to the cash transfer. And then we provide childcare, subsidized childcare support, and then we provide life skill training and education that covers a host of topics, including managing money, issues around mental health, substance abuse, and sexual and reproductive health and rights. So we are going to have what we call a mothers club, where young mothers will come together to learn about some of these daily issues that they need to be aware of. And then we want to see how that intervention would translate in terms of effect on return to school, promotion of empowerment in terms of skill acquisition. But more importantly, we want to see how it impacts their mental health. As Jane has mentioned, a lot of them are going through mental health challenges. Some even may be depressed as a result of their experiences. So we want to see what impact will this intervention have on their mental health. But not only limited to their mental health, we want to see how it will prevent repeat pregnancy, because again we are talking about the first pregnancy. In fact, there is a study done by UNFPA that shows that 1 in 3 of these young mothers would have another baby before they turn 20.
1 in 3.
1 in 3, yeah. So repeat pregnancy is also a thing among them, and they still need to be able to prevent a second pregnancy. In fact, those that have a repeat pregnancy will likely not return to school, because now they have two babies to take care of. So. So we also want to see how that intervention would impact the prevention of repeat pregnancy, but also reduction in gender-based violence. A lot of them experience gender-based violence in their relationships. So, one of the key things we want to also see is there a reduction in gender-based violence as a result of the intervention. That study, as I said, is starting. We are recruiting currently. But more importantly, I think on a larger scale, as I was saying previously, there needs to be policies around, guaranteeing their right to health as well. Because I'm a young person and I got pregnant, should not mean that I don't get the highest attainable quality of healthcare. And that includes how you address me, irrespective of my socioeconomic background, my age. So people should not be verbally abused in clinic, and I'm glad that the Ministry of Health is addressing that here in Kenya. Hopefully they will be able to come out with a guideline they are developing to tackle that issue. But also issues of social protection. It's really important. I know in South Africa there is a child care grant. It's been there since maybe even 2000. It's been there for a long time, or maybe even 1994. I'm not sure when they started giving child care grants. And what you see is it has made South Africa a model in terms of how to navigate school reentry. Because in fact, the complaint in South Africa is a lot of them are returning to school too soon. Too soon and not breastfeeding enough. That's what they talk about in South Africa. Because now they have some resources to cater for the baby, and then the grandmother can take care of the baby now because there's some resources, and then they can go back to school. Unlike many African countries where that social protection is not available. So what it means is that you have to go work to take care of your baby, if you're from a low socioeconomic background. When you go out to work, you just forget about school, because now you need to make money to take care of this baby.
And it's also the other aspect of, once you touch money, you have a sense of money. Others will be like, then why am I going to school, and yet I can work and still have access to. So it's really so much that needs to. I think that is why we were saying earlier on, different countries have their own challenges. So then maybe addressing it in a way that would sort of like address the problems, immediate problems in the country, and then even as we learn from other countries. But we'll come back and understand what we can learn from other countries. But just to go through your feedback on the question that we're asking you this morning, and that is, say one thing that you'll tell your younger self about sex and relationships. Let's get to hear what you have to say on our WhatsApp number, 0112 500 400. So this one says, hello, I am Susan from Bondo. And continues to say, I'm a victim of early pregnancy in my 16 years. I was just informed too, and I tell you, it really affected my education and ended up dropping out of school. That was in 2005. I went back to school in 2007 and continued with my education. My family members hated me for that, except my father, who made me go back to school. This has really made me to study social work and community development, and now I am supporting girls on the same. But the truth is, it is so hard, and says, ask for me if they can help me be employed. So yes, maybe you will answer that. And then, all right, so yes, can you help? The question was, can you help her be employed? I don't know, Jane? Well, because she's supporting other girls who are in the same, yeah.
Well, I'm actually glad to hear that at least the father supported her to go back to school while she was going through that whole period.
Yeah.
To respond to the question around help, unfortunately, no, we are not in a position to do that. As Anthony mentioned, we are an institution that generates evidence really to inform policy around supporting the re-entry and reintegration of girls back to school. And so we are hoping that she will get other institutions that would be willing to support even the course that she's undertaken.
I see, and it's true. There's so many, you know, organizations that in better place to help. Okay, so we, unfortunately have to bring the conversation to a close. I know 1 hour is very short, but really, what is that one, you know, advocacy? I would say either reform, change that really has to be made to ensure the success of, you know, what we're talking about, prevention and also support. And I'll take that as your parting shot in like 30 seconds, if you can.
For sure.
Okay.
The adolescent mothers really need to be supported to go back to school. So the full enforcement of the re-entry to school guidelines and the monitoring bit of it is very, very important. So my parting shot for me is that we need to support these adolescent mothers, and that also involves the support from the community.
I see. Thank you very much, Jane. And Dr. Ajayi as well. So you talked about South Africa, and this is one of the countries that we can learn from. But then again, when it comes to research, what is that one area that sort of like needs to be strengthened to help when it comes to research? Because from research is where we get, you know, data to inform policies and form policy reforms as well. 30 seconds.
Yeah, my plea will be for government to fund research.
Yes.
Because research is important.
Yes.
Yeah, the government should fund research. But more importantly, when it comes to this issue, government should fund implementation research to test approaches to change the situation. Yeah, if there are controversies around what works best to prevent pregnancy among young people, government should put resources and let's test intervention. I mean, if you want to test abstinence, let's test abstinence. Let's test abstinence plus others and see which one will have more results, and it can help us resolve some of these debates around some of these issues. But more importantly, we need to, because it's not only an education issue, it's also an health issue. We need to do more. It's also a social protection empowerment issue, and so we need to tackle this issue with all the toolboxes, you know, to make sure that young people are supported. Really.
I see that. I see that. Thanks, Dr. Ajayi. And just to read like 1 or 2 feedback from you know, what's from Facebook. This one says, this is Angela Jeragat, who says, everything has its time. Love yourself more. And then another person says, oh, interesting. This is Nashon. Anasema, just because the wrapping is, wait, what? The wrapping is wrinkled, it doesn't mean that chocolate is not sweet. It says that's from, it's a guardian angel proverb. And then one more, this one is Tudor KE and I'll tell myself to stay calm, everything will exist at the right time. But really, we've heard from you in terms of, yes, funding, and especially funding for research, but also just coming together collectively and supporting, pregnant and parenting adolescents here in the country is very important. So thank you so much for coming by today. Jen Mangwana, who's a Policy and Advocacy Manager from Africa Population and Health Research Center, as well as Dr. Anthony Ajay, Research Scientist, African Population and Health Research Center as well. Thank you so much for coming by today. Let's keep the conversation going, right? Even on our social media, platforms, our WhatsApp groups, everywhere else. Let's continue to have this conversation. But we have to end this part of the discussion here, but don't go too far because, like I said, it's Friday and it's Entertainment Friday. So we're going to have DJ Ray back here as well. We started, a show last week, and as far as, entering the last quarter of the year, and that is Praise Break. So we'll come back with more music and, dancing and laughter as well on the other side of the break. Do stay with us. The show is Your World.